Ever slice a finger while cooking? Like, whoa, that's a lot of blood for such a tiny cut.
Happens to the best of us.
It really does. And it always gets me thinking, like, how much do we really know about bleeding beyond just slapping on a Band-Aid? That's what we're diving into today, the kind of stuff EMTs train on so we can react better in those oh crap moments.
Exactly, because it's more than just basic first aid, right? This is about understanding how our bodies react when things get serious.
Exactly. And to be clear, this isn't about ditching 9/11 and playing doctor ourselves. It's about bridging that gap, those first few minutes that can make all the difference.
Absolutely. And to make sure we're getting it right, we're going straight to the source. Actual EMT training materials. I gotta say, some of this stuff was news to me, even after, all this time digging into this stuff.
Right. Like, I knew the cardiovascular system was important, but until I saw it broken down in the EMT guides, it was just kind of this vague idea of a pump and some tubes.
Totally.
Yeah.
But when you realize that if your heart's deprived of blood for even a few minutes, that's it, irreversible damage. Suddenly it's not so vague anymore.
Whoa, seriously. A few minutes. I knew blood flow was vital, but that's way more urgent than I ever pictured.
Right. That's how crucial that constant supply of oxygen-rich blood is. Think of your heart like a high-performance engine. It needs that fuel.
Okay, yeah, that analogy makes it way more real. So we've got the heart working nonstop, but it needs a way to deliver that blood everywhere. That's where arteries, veins, all that comes in.
Exactly. It's like a complex highway system. Arteries, those are their major freeways carrying that oxygenated blood from the heart. Then they branch off into smaller roads, eventually becoming capillaries.
Capillaries, those are the tiny ones, right?
So tiny that only a single red blood cell can squeeze through.
Wow, that's incredible. Makes you think all that talk about arterial bleeding, it's dramatic, but even a small venous injury can be just as bad if it's not clotting right.
Exactly. And that brings us to one of the coolest things our bodies do, clotting. It's easy to take for granted, but the EMT materials broke it down so clearly it's like magic.
Right. I always pictured it as this vague, gooey process, but it's way more intricate.
Right, so you get a cut, and these tiny cells in your blood, platelets, they're like the first responders, rush right to the injury and clump together to plug the hole.
So like our blood has its own built-in emergency response team.
Exactly. But it doesn't stop there. They lay down this foundation, and then fibrin, remember that protein, it forms this mesh like a net that reinforces the clot.
It's like our bodies have a built-in first aid kit, seriously. But what happens when it's not a small cut? Like when something big goes wrong and the body's in full-on emergency mode.
That's where your autonomic nervous system takes over. It's incredible. Actually, your body gets super strategic, prioritizing blood flow to the most vital organs.
The brain and the heart, right? Because they're running the show.
Exactly. But this is also where things get tricky. The EMT guides stressed how a change in mental status, confusion, dizziness, that's a huge red flag.
Because it could mean the brain's not getting enough blood.
Bingo. It's one of the earliest signs of shock, which basically means your body's in crisis mode, trying to maintain that blood flow where it's absolutely needed most.
So our bodies are literally trying to tell us something's wrong if we just know the signs. Speaking of which, let's talk about when things go wrong in a really obvious, kind of scary way. External bleeding.
Now we're getting to the good stuff. Or, well, not good exactly, but definitely important.
Right, because while it can be alarming to see, knowing how to gauge the severity, that's key. So we're back at diving deeper into the world of bleeding, which, let's face it, is something most of us would rather avoid.
No argument there.
Last time we were talking about external bleeding, those cuts and scrapes we can see, but the EMT guides really emphasize that it's internal bleeding that can be the most dangerous.
Absolutely. Out of sight, out of mind. Right. But that's exactly what makes it so dangerous.
It's like with external bleeding, at least you know what you're dealing with, but internal, that feels scarier because it's harder to detect.
Yeah.
So how do we even know if we're dealing with internal bleeding? What are the signs?
Well, one of the biggest clues is what the EMT materials call mechanism of injury. So think about the force involved in things like falls, car accidents, even those really hard impacts you see in sports.
Right, those big, obvious traumas. But I remember the guides also mentioned things like ulcers and aneurysms, which aren't quite as obvious. It makes sense, though. Those can cause some serious internal damage.
Exactly. And that's why it's so important to be aware of those less obvious causes.
So pain is obviously a red flag, but what else should we be looking for? What are some other signs our bodies might be trying to tell us, hey, something's wrong in here?
Well, for one, keep an eye out for blood and vomit or stool. That's never something to ignore.
Okay, definitely not good.
And chest pain, especially if it comes with difficulty breathing, that's another major red flag.
It seems like those subtle signs of shock we talked about earlier, the pale skin, the dizziness, racing pulse, those could also be signs of internal bleeding.
Absolutely. Your body's trying to compensate for that blood loss any way it can, and those are some of the ways it does that.
Wow, so it really is like our body is trying to communicate with us, sending out these SOS signals. So we've got these signs, both obvious and subtle, but what do we actually do about it? What's in an EMT's toolkit besides just bandages?
Well, I think the most important tool is knowing when to call 911. Nothing replaces that, but
Hmm.
knowing how to control bleeding in those first few minutes, that can literally be the difference between life and death.
It's about empowering ourselves to take action, right? Bridging that gap until help arrives. So let's talk about those first few minutes. We hear a lot about direct pressure seems simple enough, but what's the science behind it?
It all goes back to those amazing clotting factors we were talking about. Direct pressure, it helps stop the flow of blood long enough for those platelets and fibrin to do their thing and form that clot. So you're basically buying time for your body's natural healing process to kick in.
So it's not just about pressing hard. It's about pressing strategically, giving those clotting agents a chance to work their magic. Okay, what about pressure dressings? Those always seem a little more, I don't know, official.
They're all about maintaining that direct pressure over time. That's why the wrapping technique is so important. You're basically creating a snug support system for the wound so that pressure stays consistent.
Okay, so it's like a more advanced form of direct pressure.
Exactly.
Got it. Now, I have to ask about tourniquets. Those are one of those things that always seem kind of extreme, like something out of a war movie or something.
Yeah, they can seem intimidating, but honestly, in the right circumstances, a tourniquet can be the difference between life and limb.
Wow, okay. So when is it appropriate to use a tourniquet? And how do we even use one correctly?
So, a tourniquet is a last resort, really. We're talking about severe, life-threatening bleeding from a limb, like if direct pressure isn't working. And you're right, there's a specific way to apply it. Remember, high and tight, as close to the torso as you can get it, and never, ever cover a tourniquet with a bandage. EMTs need to be able to see it right away.
Okay, so it's about maximizing effectiveness, but also communicating clearly with the first responders. It makes you realize how critical even those little details can be.
Oh, absolutely. Every second counts in an emergency. And speaking of tools, let's not forget about splints. We usually associate those with broken bones, right?
Yeah, totally. But the EMT material mentioned that they can help with internal bleeding too. How does that even work?
Right. Well, a splint, it helps immobilize the injured area, which can actually minimize bleeding by reducing movement. It's all about keeping things still to allow that clotting process to do its job.
It's amazing how interconnected all of these techniques are. Speaking of interconnected, let's talk about a type of bleeding that might seem a little less life or death, but it's incredibly common. Nosebleeds. Any special tips on those?
Oh, yeah, nosebleeds, everyone's had one, right? First things first, lean forward, not back. You want the blood to flow out, not down your throat. Then pinch the soft part of your nose right above the nostrils for at least 15 minutes. And I mean a full 15 minutes, no peeking to see if it stopped.
Oh, I am so guilty of that.
Yeah.
This is all such good advice, but it's a lot to remember. What if, in the heat of the moment, you forget it all?
That's totally understandable, but here's the thing. Your body, it's always talking to you. Trust your instincts. If a situation feels serious, don't hesitate to call for help. It's always better to err on the side of caution. You are your own best advocate.
Wow, so we've really covered it all, haven't we? From the tiniest capillaries to full-on tourniquets. It's a lot to take in, but super fascinating.
It really is. And it makes you realize how much we take for granted. Like, our bodies are doing all this incredible stuff behind the scenes, and we don't even realize it.
Exactly. But knowing how it all works, it's kind of empowering.
Absolutely. Knowledge is power, especially when it comes to those, oh, crap situations.
Right, but that's what I keep coming back to. What if you're in the moment, freaking out, and all this stuff we've talked about just flies out the window? How do you know when it's really an emergency? Like, when do you call 911?
That's a tough one. Even trained EMTs, they have to make those judgment calls, and sometimes those are the hardest.
Yeah, totally. So how do they do it?
Well, a lot of it comes down to those subtle signs we've been talking about. The EMT guides stressed those again and again because they're your early warning system.
Okay, so let's talk about those. We mentioned things like pale skin, dizziness, racing pulse.
Right, so it's not just pale skin. It's pale, cool, and clammy. That's a big one.
Okay, and that's true for both kids and adults.
Absolutely. And don't just look at their skin. Listen to what they're saying, how they're acting. Are they confused, disoriented, getting really anxious?
Because that could mean their brain isn't getting enough blood, right?
Exactly. Like their body's sending an SOS, but instead of a siren, it's like a change in their whole demeanor.
That's honestly kind of terrifying, but good to know.
And look, I know we've thrown a lot of info at you today, but if you take away just one thing, when in doubt, call 911. It's always better to err on the side of caution.
100%. I feel like I've learned so much, and I'm definitely going to look at Band-Aid a little differently now.
Me too. But hey, that's the whole point of these deep dives, right? To get us thinking differently and feeling more prepared for whatever life throws at us.
Totally. Because knowledge is power, and when it comes to bleeding, that knowledge could actually save a life. So, to our listeners, stay safe out there, and we'll catch you next time for another deep dive.